All right, hey everyone. I want to introduce you today to Dr. Matthew Parker. He has a long list of accomplishments. I'm going to try to shorten it up for us, but give you a little bit of background. Dr. Parker was born and raised in Cincinnati. He did his dental school at The Ohio State University, became a specialist in periodontics down in Alabama. Dr. Parker also served in the Navy, we're proud to say. He completed deployments to both Iraq and Afghanistan. Dr. Parker's an excellent surgeon, great father, husband, and I'm proud to call him a friend. Dr. Parker, thanks for joining us.
Thanks, Lee. I'm happy to be here.
Well, this is cool stuff. We've been talking to people about dental implants for a while. Some of the advantages, some of the things that they can do, but I wanted to talk to someone who deals with dental implants day in and day out. As our patients know, we do the restorative part. We help to rebuild the function and the aesthetic component, but the person that's doing the surgical component, I wanted to talk with them a little bit. So how long have you been working with dental implants, Dr. Parker?
Lee, it goes back all the way to the year 2000. And there's been a lot of changes in the field of implant dentistry, over the last 2 decades. But we are to a position now where we place about 500 implants a year in all kinds of different, situations where patients come in and it may be one tooth that they're missing, and maybe an entire arch or an entire mouth, where the teeth no longer are really serviceable. And so we sort of use our expertise to kind of come up with the best solution for that particular situation. The one thing I will say over the last 20 years is the usefulness in terms of being able to use implants in a variety of different ways to recycle implants, repurpose them. The versatility in terms of how implants can be used to rehabilitate someone has grown dramatically.
That's exciting stuff, because for the longest time, as you kind of alluded to, we did not have that capability. And seeing people live longer and have higher expectations for quality of life, that's going to become more and more important down the road.
Yeah, I mean, it's a real game changer in terms of, we get patients in on a weekly basis who say, absolutely, I do not want to end up like my grandparents or my parents did, and thankfully with implants, we can avoid that eventuality. We can offer them something that is much better, both functionally and aesthetically.
That's awesome. Now, you do all kinds of implants and situations, but what would you say are some of the most impactful procedures that you're involved in? What are these life-changing things that are just really fun to help people with?
Well, I think in terms of like an instantaneous change, I think a lot of people are familiar with the teeth in a day concept. And I think what I like about that is just how impactful and how quick the transformation is. So the way that we are set up, we have an in-house full-time lab tech who's got literally over 4 decades of experience. And so we could take a case or patient who is completely broken down, either edentulous or, meaning having no teeth, or having very severe gum disease. And within about a 6-hour window, we were able to have them walk out of the office with something that looks great, functions well, and really allows them to heal very uneventfully.
I can imagine there's been times where people have completed the surgery and quite literally just crying, overcome with emotion. It's got to be so amazing for them.
Yeah, I mean, it is, we use implants in a lot of ways, but in terms of just kind of an instant life-changing impact and sort of a flood of emotion that you're referring to, it's really neat to see. And it really makes you kind of get in tune with the fact that, these people have been sort of struggling internally with this situation for a very, very long time, and just, hadn't found the right resource, the right team to help them.
That's awesome. That's awesome. Now with all this, the level of skill, expertise, technology has to be pretty intense. It's got to be pretty high level. Now, what are some of the things that you guys do to ensure the highest quality results?
Well, I mean, I think surgical experience goes a long way. And so, having a surgeon that's been doing this for 20 years is certainly beneficial. But we have set up a team around me that I think is second to none, in terms of the surgical specialist in Cincinnati. And we get comments all the time in terms of how patients feel when they come in. And, the old adage is, they don't care how much you know until they know how much you care. And so I think getting patients comfortable in the beginning and giving them that confidence that we really kind of know what we're doing. We have all of our steps in the process pretty buttoned down. I think that builds a lot of confidence, and we have a team that is really sort of built to see patients all the way through from the initial visit until they get back to an office like yours, Lee, for the final restoration. And it's sort of a combination of old-fashioned, down-to-earth caringness and the latest that dental technology has to offer.
Yeah, it's got to be a combination of the two, and I think that's something you excel with. So that's why we love for people to come see you. Now, common thing that we're going to run into is the fear of discomfort, the fear of pain. So I think it'd be good to talk about how we can help people stay as physically comfortable as possible. So what do you guys do to help people through that process if they're anxious or nervous about the procedure?
Well, I think there's two ways to tackle that question. I think first and foremost, there's a certain anxiety and a certain trepidation in terms of the actual procedure and getting through the process. And to that end, we do intravenous conscious sedation, where a patient is pretty much rendered, they're conscious, but they're in a comfortable, relaxed, forgetful state. And so that allows us to do more in fewer visits, allows us to do these type of treatments a lot more efficiently, and the patient is a lot more accepting of that. In terms of how people feel after they leave the office, a lot of that comes down to surgical technique. And but I will say that in situations where we're able to, this teeth in a day concept, when we're able to fixate something, when we're able to use the implants right out of the gate to stabilize whatever sort of temporary denture or temporary crown that we're putting on the patient, those patients do much better postoperatively, simply because things aren't moving around.
Yeah.
And that's a service that we're able to offer because we have Tom, our lab technician, in the office, 4 days a week when I'm in the practice.
Man, that's huge to have not only your surgical experience, your great team around you, but to have someone like Tom who's been doing this for so long and can help make this process go more smoothly for everyone and help with the aesthetics that we're all looking for. We want it to look good too. So
yeah, I mean, I think these cases come to fruition and end up turning out as well as they can when you sort of work from the end result that everybody wants backwards. And so a lot of the time that we spend with treatment planning, a lot of stuff that patients don't necessarily see that you and I are doing behind the scenes between visits and before treatment is initiated, really is key to getting the results that we expect, and then I think our patients expect.
Absolutely. Now, one final question for you, Dr. Parker. There's a lot of people that are on the fence. Is it worth it? Should I do it? I don't know. What would you say to someone kind of having been on the front lines for so long? What would you say to someone on the fence whether they should explore their options?
Yeah, I mean, I get that. I get that comment with some regularity, and I will tell you that the patients that ultimately move forward, almost to a person, say to me that they wish they would have done this sooner. And I, it's not to dismiss or diminish, the concern and sort of the inertia to kind of move forward and do something. But I think that where a lot of people kind of get themselves over that hump is after they come meet with us. We are very education oriented. We're not, one solution for every case. So I think when patients start to gain a level of trust, they understand they're in the right place. They understand that we want them invested in making the decisions as to what makes the most sense for them, not just in the short run, but longer term. And I spend a lot of time sort of looking into my crystal ball and saying, well, we've got this immediate concern now, but we need to have the ability to adapt and kind of look into the future so that we're able to help this person without necessarily going all the way back to step one. Okay. So I think it comes down to, you got nothing to lose to come talk to us. And I think that you will be very impressed by the experience. And I think that you will, at a minimum, walk away with a much greater knowledge and understanding of what's possible, what's going on in your mouth, and how it might be addressed.
Amen. Amen. I really appreciate you taking the time today, Dr. Parker. I think everyone can tell from listening to him that he not only has great experience, but he cares a lot about what he does, and the impact it has on people's lives are amazing. So thank you so much for taking the time, Doctor, and hopefully we'll see you soon.
Thanks, Lee. Look forward to working with you again.
Absolutely.
Bye-bye.